Everybody. Well, it's very, very nice to be here. And I want to thank you, Stephen Spartero, for really helping me and taking me by the hand, because this is quite an adjustment for all of us, that is for sure. And when we think about what's going on and what's gone on in the last couple of months with the virus and how it has affected people's lives in all kinds of ways, physically, emotionally, mentally. People have lost their jobs, they've lost their businesses. There's been all kinds of adjustments that we've all had to make in terms of childcare and concerns about healthcare. And yet, I want to be able to really put a positive spin on this. And I think that in reality, it's proving to be, and I'm seeing this with myself, with patients, with friends, a really good time to reflect and to evaluate and reevaluate what is really important in our lives. And of course, then to really reset. And of course, today's talk is about never make a mistake in love again. And, in the midst of all the ups and downs that we have gone through, I am so thrilled to be able to share some really good news with you. And of course, this good news is not just my opinions and feelings, but it's based on my research. It's based on my book, For Better, For Worse, Forever, Discover the Path to Lasting Love, and to over 35 years of clinical experience. And, when I talk about this every single week on my Ask Beatty radio show on the Progressive Radio Network, I can hardly believe that I have been a practicing psychotherapist and sex therapist for all of these years, and I have learned a great deal for myself personally, and of course for my patients. And but the reality is, and this is what's so interesting, because I was writing an article this past week, is that despite all the self-help books and the shows and the podcasts and the experts, the dating experts and the relationship experts, the reality is that we are not doing very well in our relationship lives at all. And before I give you all the good news, because not only am I very, very clear about what the problems are, what I have learned over all these years is exactly what we need to do. And for people who know me, I'm a very, very practical psychotherapist and sex therapist. So I'm very clear about the things that we need to do to never make a mistake in love again. But I want to give you some of the reality statistics about what is going on in this country. For example, the divorce rate for first marriages in the United States is 48%. And for second marriages, that number goes up. It goes up to 67%. And for third marriages or more, and a lot of people are really surprised about this, because you would hope and you would think that we learned something, after divorcing, after a first marriage, after a second marriage. But the divorce rate for third marriages is 73%. Also, you may not be aware of this if you're looking into the world of domestic violence. 4 women are murdered every single day by their so-called intimate partner. 1 in 10 girls are the victim of dating abuse, and between 21% to 30% of college students report having experienced dating violence by a current partner. So what is it, my friends, that is really, really going on? Well, what I have discovered, and this is really the good news, and for those of you who are on the Zoom call right now, I am assuming that you are going to be ready to do some really, really serious work. So what I have learned is that relationships fail primarily for 4 reasons. Number one, what we all need to do is to make sure that each of us is in a really good place emotionally and psychologically and psychiatrically, because unless we are in a good place and we have dealt and we are dealing with, in quotes, our unfinished business and our own skeletons in the closet, and we all have unfinished business, we all have skeletons in the closet. Many, many people, millions of people are dealing with depression and anxiety and addictions of various different kinds, problems stemming from our own family of origin. And the reality is that if we are looking for someone to save us, we are going to look for a very, very long time. And as I used to tell my daughter Jordana, and I actually wrote my book for my daughter, the relationship as I see it, and it'd be interesting to hear what you all have to say later, needs to be the icing on the cake, and we need to be the cake. We need to be solid. Our foundation needs to be solid so that we all have, all of us, therapists, all of us, we all have work to do to make sure that we are in fact okay, and that we are going to be entering relationships feeling good about ourselves with good self-esteem, and that we're feeling healthy, and that all we are really wanting is a wonderful addition to ourselves that hopefully is feeling good about ourselves, and it's feeling strong emotionally, psychologically, and psychiatrically. And unfortunately, we cannot bypass this first step. I think that a lot of people, we would hope and we would dream and we would wish that we could just find somebody who is going to rescue us, rescue the damsel in distress, or rescue a man who's been struggling. And we all struggle. That's the whole point. We all struggle at different times in our life. But if you're finding that your depression or anxiety or untreated psychiatric, other kinds of problems, substance abuse of various different kinds, sexual abuse stemming from your own family situation or from things that happened years and years ago are getting in the way of your life and your relationship, I want you to give yourself permission once and for all, actually, whether or not you want a relationship or whether or not you just want to be happier in your own life, to give yourself permission finally to acknowledge and address and resolve as best as we can the things that are getting in the way of our lives. So that actually is step number 1. Step number 2, and what I have discovered, is that the majority of people, and I say this to you very, very respectfully, have not learned the ingredients that actually go into a healthy relationship. Because when you think about it, if we were not fortunate enough to grow up in a family where we saw good communication and we saw good problem-solving skills, where are we going to learn about relationships these days? Certainly, we don't learn really anything that is important and significant and positive when we're watching all of the dysfunctional shows that are so often on the various different TV networks. So again, what we need to do is, this is an educational type of a learning curve. We need to be willing to educate ourselves about what healthy relationships are and what healthy relationships are not. And certainly in the United States, for the most part, I mean, these are things that are not taught to students in school, so that we're really left alone to our own devices to try to figure all of this out. so that we need to be willing to really educate ourselves and become a lot more savvy when it comes to healthy relationships and what healthy relationships are and what healthy relationships are not. And number three, and this is what my research was about, and this is what my book is about, I developed a 10-step formula that teaches people exactly how to assess who's right for you and who's wrong for you before committing to any serious relationship. It's like doing a diagnostic assessment in my office. I mean, it may take me a couple of sessions in order to be able to do a really good in-depth evaluation. But when I did my research with 450 people in the Providence, Boston, Connecticut area, what I learned is that for most of us to do a really good assessment, to find out who our partner is or is not, it cannot happen in a week. It cannot happen in a month. It cannot happen, I believe, in 90 days. My findings were that it takes about a year to really, really find out who your partner is and who your partner is not. And something interesting too is that many people believe that the best way to build relationships and stronger families is to attack the barriers keeping people from achieving their full potential. Issues like poverty and racism and income inequality and unemployment and homophobia are often cited as the primary reasons why we are struggling. And yes, we really are struggling in our personal relationships. And what I found is that even though they are definitely important contributing factors to marital and to family strife, that removing these barriers on their own will not solve the problem. And you probably wonder, well, how does she know that? Well, in the past 35 years, I have treated some of the wealthiest and best educated people here in the United States. And I can definitely and definitively say that the relationship problems, so we're not talking about people who are struggling to put food on the table for their children and to pay the rent, but we're talking about relationship issues, the communication, the problem solving, the sexual problems, the emotional intimacy kinds of issues are no different. They're no different from the people who I treated in the inner city areas in Montreal. I'm Canadian, I have dual citizenship, and the people who I have treated from the Ivy League world of the rich and the famous. And again, you know, what I have found, you know, over and over and over again, and of course I'm going to tell you exactly what you need to do specifically so that you're never going to make a mistake in love again. But the fact is that my formula, and I'm really hoping that you are going to want to use it if you are planning to find a healthy relationship. My formula is not about teaching you how to flirt or teaching you what site to go on or whether you should swipe right or whether you should swipe left. What I am going to do is teach you exactly what I've learned over all these years when it comes to doing really, really good in-depth assessments. And I know that for those of you who are on Zoom now, you're probably wondering, my, this is really a lot of work. I was hoping that she was going to have some magic answer. Well, these are actually magic answers, but these magic answers do require that we do some work. So Where do we begin? Well, we begin at the beginning, just as I do in my practice. So you're getting to know somebody. You've met somebody, and you like them. You're attracted to them. And I want to say something though that I again learned, and I've learned a lot. I wish I had had all this information, frankly, when I began my own dating and relationship life. It would have made my life a lot easier. If I had had access to this kind of information. And, you know, before I did the research and before I wrote the book, I used to be a very spontaneous person when it came to making evaluations about people. So I would make a comment like, I met this terrific woman, or I met this terrific man. But after all these years and what I've learned, I would never, ever make that kind of definitive statement again. So the question really is, what would I say? All I could say until I go about making my assessments is that this person appears to be, and that's the key. The person appears to be wonderful and trustworthy and terrific and available emotionally and physically and sexually. We can't make these kinds of determinations until we go through the process of assessment. So having said that, okay, we're beginning at the beginning. Now, you don't want to put your potential partner or your potential love interest on trial. But what you need to do is find out in the beginning, what did your partner, what did he or she learn from his or her family of origin about relationships? What was it like growing up in your family? What did you see if you were lucky enough to grow up in a family where there was a mom and dad? What kind of communication was there? Was there abuse of any kind? Was there substance abuse? Was there physical abuse? You really want to find out, because that is where initially we do learn about relationships, even though we never even dream that we're learning anything about relationships at all. Now, because somebody was unfortunate to grow up in a home where there may have been abuse of various different kinds, whether it was alcoholism or drug abuse or physical abuse or emotional abuse or sexual abuse, you're not going to throw somebody away because they were unlucky in terms of their family of origin. But what you want to hear something like this. You know, I was raised in a family. It was really tough. It was really tough. It was a really dysfunctional family. My father beat my mom. My mom drank too much. There was just too much prescription medication that people were taking. There was verbal abuse. There was physical abuse. But what I've learned, and that's what you are looking to hear, what I've learned is that I don't want to repeat history. I've gone for therapy. I've read books. I've taken relationship education courses, and I'm in a much better place right now because I have learned that I do not want to have the same kind of a relationship that my parents did, or the same kind of relationship that I witnessed relatives and friends having when I was growing up. And that is a wonderful green light, because, you know, first of all, that the person was really honest and open, and it must have been very difficult to be able to express that kind of honesty to you. But what you've learned, and of course, you know, the proof is in the pudding, and, you know, I often say it's not what people say, it's what they do. So as you go through the process, you are going to be able to see whether or not, in fact, the person has, you know, more or less, nothing is perfect, none of us are perfect, has really learned the healthy lessons about what relationships need if they are to work. And of course, in the meantime, as you are assessing your partner, you also need to be looking at yourself, and you may find that you do have some unfinished business or skeletons in your own closet from your family of origin that do need to be acknowledged and addressed and resolved. So that's the first thing, predicting the future, looking at family background. The second thing is what I call skeletons in the closet. And these are things that are not really visible to the untrained eye. We're talking about HPV. We're talking about a variety of different sexual, physical diseases. We're talking about things like alcoholism and substance abuse of various different kinds. Because as you know, for those of you who've ever been involved with an alcoholic or a drug user, that they are not good candidates for any relationship. Their intimate relationship is with their drugs and with their alcohol. So you need to be aware of the signs and the symptoms of these kinds of problems and be honest with yourself. I mean, I had a situation in Sarasota. I had a private practice in Sarasota for a number of years, and a woman was referred to me, beautiful and smart and educated, and she happened to be very, very wealthy. And for her first visit, I asked her, what brings you here? And she says, I have to tell you that my husband, he hit me. And we were away on a cruise, and he had been drinking too much, and he hit me, and he hurt me, and I'm actually, I don't know what to do. I love him. We have a great lifestyle, and maybe it wasn't such a bad thing because he was out of control. Well, when I started to really explore her family background, what did I learn? Well, what I learned was this is a woman who had been abused virtually every single day, physically abused virtually every single day by her father when she was growing up as a child. So in her mind, being hit maybe just once a year was not such a bad thing. Of course, it was a very, very bad thing. And she really started to learn that, where she came from, where abuse was just a common, almost everyday kind of a phenomenon, that it was very, very easy then for her to minimize what was going on with her husband. So I worked with her for a few months. We explored things that happened and didn't happen when she was growing up. And it was the time to bring in her husband. And in walks this very sophisticated, very elegant looking man. And she sat there and she said to him, she said, I don't care about, what happened in terms of that, your apologies, that you said you were drinking too much. But if you ever, ever, ever hit me again, that I am going to leave you. And he was absolutely shocked. This is a woman who had kept her feelings inside, had not really looked at her life all that carefully prior to this event. And I remember seeing them at an event a couple of years later, and she looked at me and she said, things are really, really okay. So again, it's just so important to be honest with ourselves and not make a lot of excuses for people's bad behavior. And as I say to my patients, and by the way, I have a private practice here in New York City and also in East Hampton, it's very important that we are mindful every single day in our interactions with ourselves and with others, that we are doing things that are in our best interest. And being with somebody who is a substance abuser and doesn't want to get any help, being with somebody who is verbally and emotionally and physically abusive, even if it is only on occasion, it is not okay. And you need to give yourself permission when you see those kinds of behavior to extricate, because listen, there are millions of women who are killed. 4 women every single day are killed by their intimate partners, so that we need to be smart and we need to be self-protective. And it is always a dilemma for many, many people, should I stay or should I leave? Now, moving along and looking at other skeletons in the closet. And these skeletons in the closet have to do with untreated psychiatric problems. Again, we are not going to throw away people because they have depression or anxiety or bipolar disorder or other kinds of problems. But let me tell you, if you are with someone who is in denial, who is not willing, not only for the sake of the relationship, but for themselves as well, to acknowledge and address and resolve as best as one can these problems, you are really headed for a lot of trouble. And this is where communication is so important. And, when we talk about communication, it's easy when we're talking about where should we go for dinner and should we plan a trip or what should we buy or what should we order for dinner. But the fact is that real communication, and it is an art. And unfortunately, this is something also that none of us are ever taught. If we haven't been lucky enough to witness great communication and problem solving skills in our own family of origin, we certainly don't learn any of this in school. Again, we are left to our own devices to really, really try and figure all this out, so that in a healthy relationship, in a truly healthy relationship, we ought to be able to express the full gamut of emotions, sadness and pain and scare and disappointment and anger, and not be afraid to really be honest with our partner. And yes, it means risking, but what's also so important is that we all need to know in the real world how our partner, how the person who we think that we love and that we may want to spend the rest of our lives with is going to respond to true emotion. And are we able to express our feelings honestly and openly? And, people ask me all the time, when I'm interviewed, what are the most important ingredients that make or break relationships? Well, as unsexy and as unromantic as all of this is, the reality is that it happens to be emotional communication and problem solving. And as you're getting to know each other, as you're getting to know someone, and when things start to get off track, now, I tell my patients, all the time, there isn't such a thing as a perfect relationship, not for me, not for you, not for anybody. But it is about trying to work out and sort out differences. And it is risky and it is scary to say to somebody, especially somebody who you're getting to know, I don't like the way that you just spoke with me. I'm concerned about this, that, or whatever. I've noticed that you're drinking a lot, or you've been drinking too much. Is there something going on? I don't like the tone of your voice. I noticed that you hit the dog and you slammed your hand against a wall when you were really angry. That makes me feel uncomfortable. So risky to say, but it's important to say, because you, in your assessment of this person, and in order for you to keep yourself safe, you need to find out what your partner, this person who you're really wanting to get to know better, how is this person going to respond? Is this person just going to blow you off and say, oh, boy, you're just overreacting, you're making things up? Is this person going to gaslight you? Or is this person going to take some time and reflect and say, yes, I have been having a hard time, and I have been drinking too much, and I really appreciate the fact that you mentioned this, because this is something, this has been a pattern perhaps in other relationships, but you're important to me, our relationship is important to me, so that I am going to take care of business. And that is exactly what you want to hear. This is exactly what we all need to hear. And when you're looking at problem solving, the one thing that we all have to recognize is that we don't always get exactly what we want. And effective problem solving involves the following. It involves being able to have a discussion where there is a two-way discussion, not a monologue, but where there is a two-way discussion, where people are willing and people are able to make compromises and to make trade-offs. And the object of the exercise, of course, is to come up with a win-win resolution. And that is what is so important for all of us to find out about our relationships and to find out about our partners. And if you have somebody who you're with and you're dating who says, no, 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 I don't want to talk about this, and who walks out, slams the door, and pretends that what you have to say and that your concerns are not important, where you are invalidated over and over and over again, that is a significant red flag. And I'm sure that many of you know exactly what I'm talking about. That is absolutely not okay, and is absolutely not compromisable. So what is, effective communication? I mean, it's finding the words and finding the way and finding the right time. And, I joke about this, but it's really true. Not when you're going to bed and not when you're waking up in the morning and you're just getting ready to go to work. Finding the right way, finding the words, and finding the time to say it well. And for many of you, you probably know that I've been an expert guest in national television for over 25 years, probably for 30 years, and for shows that are taped. Many of them are live, but many of the shows have also been taped. If we don't like the first take, if the director doesn't like the first take, we need to do it over and over and over again, so that if you're finding with your partner that somehow your initial communication is not working, what I recommend that you do is that you take a break and say something like, this isn't working very well right now. Why don't we stop and figure out a better way to say it well? And when people do this, it's absolutely amazing. It's amazing what can be accomplished and what can be resolved. And I know that I'm throwing a lot at you. And, in our society, we want everything now. We want the quick fix. We want to just be given a pill, which leads me to, of course, mention about how overly medicated Americans are, particularly in the world of psychiatry and probably, in medicine across the board. So this is not a quick fix. And as I mentioned to you, my research found that it does take close to a year to find out who somebody is and isn't, so that you're doing your research. Because the fact is that most people spend a lot more time researching phones and computers and grams of fat and cars and all kinds of things, and that we don't really think about assessment when it comes to people that we are meeting, and that we bypass this very, very important issue. And unfortunately, it invariably gets us into a lot of trouble. So moving along, what other things do you need to be looking for, and what other things do you need to be assessing? Well, intimacy. Now, when people talk about intimacy, most people will assume that we're talking about sex. That's another chapter, and that's another subject. When I talk about intimacy, and when you are looking whether or not your partner is capable of intimacy, of emotional intimacy, we're talking about caring and sharing and trust and respect. And can I help you with the dishes? And is there something that I can do, darling, to make your day better and to make your day easier? That is what we are talking about when we're talking about emotional intimacy. Now, let me make a point here, is that we can have great emotional intimacy and have no sexual connection, sexual intimacy. And we can have a great, great sexual chemical relationship where there is very little of any emotional intimacy. And obviously, you know, we want it both. But it's really important, again, for you to know the difference and for you to be aware of the difference between imitating intimacy, which what I call sexual illusions, and real emotional intimacy. And again, I want to just reinforce the fact that nothing is perfect. No one is perfect. There is no perfect relationship. There are going to be lots and lots and lots and ups and downs in our lives. But these are the fundamentals that you want to have in your relationship if you are going to have a loving and secure and healthy relationship. And then we get to the whole issue of sex. And the fact is that we are not doing all that well in the bedroom. People are struggling. There was a study that was done at Johns Hopkins University. And this was a study with 100 married couples who defined their relationships as either happy or very, very happy. And the results are very interesting. And I think you're going to find them very interesting, that 50% of these happy and very happily married women had difficulty becoming aroused. An additional 25% of these happy and very happily married women had problems with orgasm. 15% of these women were unable to achieve orgasm under any circumstances at all. With the men, a third of the men had issues with premature ejaculation, which, by the way, is a really, really, really easy problem to solve. There are techniques that I'm able to teach men. There are numbing creams, so that there is no reason at all why, you know, men have to struggle on their own with this issue. It's just a question. It's just a question of really knowing what to do. And I'll tell you a really cute story. A young man, he was in his early 20s, came in to see me for therapy, and his problem with his girlfriend was premature ejaculation. And I showed him there was a squeeze technique, there was a stop-start technique that I showed him what to do with his fingers, I have to tell you. And that was in conjunction with the numbing cream. And here he was, a really young guy. And so he kept a graph, and he came back the following week. This was just after having met me for the first time. And he was able, within a very short time, of course, he was practicing 2 to 3 times a day. He was in his 20s, so he had a lot of energy and he had time. And the problem was resolved. Okay, so if that is an issue for you, as I say, there are a lot of things that you can do so that it will no longer be a problem. With erectile dysfunction, and this is the number that many, many people are also very surprised about, that 52% of men between the ages of 40 and 70 have issues to a greater or lesser degree with erectile dysfunction. And the reality is, the unfortunate reality is that most men will go to a doctor. And what I found, and I say this to my husband Jim all the time, you know, we laugh about this, the doctors are very, very reluctant, for the most part, to even talk about sex. And I have to share with you that in all the years that I have, visited gynecologists, there's nobody that has ever asked me, what is your sex life like? Fortunately, I have a really good sex life, but it's never, never, ever come up. So with erectile dysfunction, most men, if they go in, they're either given a Viagra or Cialis or Levitra, when in fact studies show that the first question that really needs to be asked and looked into is, why is there not sufficient blood flow to the penis? And oftentimes there are cardiac issues. So the doctor needs to slow down, and instead of just routinely prescribing the pill, to get to the root of the problem and find out, what is this all about? And of course, anxiety and depression are also factors if we're looking at people's sex lives. All the medication, including antidepressant medication, there are sexual side effects with all of the pills, which is why we need to ask our doctors, what are the side effects? Are there sexual side effects that we are going to have to deal with? And of course, if the relationship is not in a good place, that is going to be another issue, particularly for women, but also for men, that is going to get in the way of our sex lives. And of course, alcohol and drugs, these are depressants. So again, in trying to understand, what it is that's going on, you have to take a very, very holistic approach in understanding why something is not working, rather than simply putting a bandage on the problem, which typically is not going to work at all. So moving along, looking at old baggage and past relationships. And I think that it's very, very important, if we're honest with ourselves, that we really look at our own relationship history. And it is very easy for all of us to blame our partners, our past relationships and our past partners, for why things didn't work out. And yet we also need to, and perhaps we did make a lot of mistakes in terms of the people who we were choosing to be with. But it's also very, very important for us to look at ourselves. In fact, I had a situation just a couple of weeks ago. A neighbor, I bumped into her in the elevator, and I asked her, I said, how are you? She says, well, not so good. She says, I got married. And I said, oh, wow, that's great. And she says, my marriage lasted for 7 days. I said, oh, wow. I mean, that's incredible. And she had been with this man for quite some time. And I asked her, I said, so what do you think happened? And she took a long, long pause. And what she says was, she said, my issues, my problems, my unfinished business, she didn't use that term, really, really got in the way of my relationship and my marriage. And I really blew it with a terrific, terrific man. So as a neighbor, I went down to the apartment and I gave her my book, and I hope that she's going to read the book. And she said that she was in therapy and was going to honestly look at the problems and the role that she has played in her marriage, in her 7-day marriage, and in past relationships that had yet to be acknowledged and addressed and resolved. And also, you know, when you're looking at past marriages, and you have to ask yourself too, you know, do you want to be involved, and to what degree do you want to be involved with somebody who has exes? Of course, with the divorce statistics being what they are, certainly the majority of people are going to be meeting people who are divorced or separated or widowed. And you have to ask yourself, you know, are you willing? Are you willing to deal with exes? And are you willing to deal with alimony? And are you willing to deal with children who initially may not want to have anything to do with you? And these are just issues and problems that need to be talked about. I mean, people who are marrying for the second and third time and who have children and have baggage and have exes and have alimony and have child support. I mean, this is just kind of the way it is. But these are the topics. These are the topics that need to be acknowledged and addressed and resolved. So it's not about the problems not existing. It is how well or how badly you and your partner are really able to deal with conflict, to deal with difficulties, to deal with issues. And this is where you kind of get back to the beginning, where emotional communication and problem-solving skills are so critical. Again, not sexy, but absolutely critical. Then you have to look at other very practical things, especially if you are wanting this to be a permanent relationship, or you hope it's going to be a permanent relationship. And I call this deal makers, deal breakers. So things like talking about your goals and your values openly with your partner. What is important? Politically, financially, lifestyle-wise. I mean, if you want to live in Alaska and your partner wants to live in Florida, unless you're able to have 2 homes, that is going to be an issue. So that you need to be able to really put it out there and ask yourself, you know, what kind of a deal, I hate to put it that way, but really, what kind of a deal are you willing to agree to? What kind of compromises are you willing to make? What kinds of things are absolutely not compromisable? For example, somebody who really wants children and somebody who really doesn't want children, I'm not sure how you're going to make a compromise deal with those kinds of differences. You know, people who are very, very different politically. Maybe people would be willing to learn from one another. Of course, if it becomes a battlefield, if politics then becomes a battlefield, you have to ask yourself, is this the sort of life that you're going to want to lead, where you're constantly and continually battling your partner about a progressive way of looking at life and a Trump way of looking at life. So again, there's so many questions that need to be asked, that we need to ask ourselves, and of course that we need to discuss with our partner, to really again be able to look at the reality, not the fantasy, of our relationship. And then as we go through, let's assume that you're still in this relationship and you're getting to the end of a year and things are looking pretty well. Again, nothing's perfect, but you know, the most important ingredients are definitely present. Realizing again that there is not such a thing as a perfect partner, but there are three questions. And I think that these three questions are probably the most important three questions that you need to ask yourself. The first, what is it that I really, and I suggest people to write this down, and at the end of every chapter in my book, For Better, For Worse, Forever, Discover the Path to Lasting Love, by the way, you can get it on Amazon, there are exercises. So I don't want people to just think about the answers. I ask people to write the exercise answers in their own handwriting. So the first question again is, what do I really want and need in a relationship? What is really, really, really important? Of course, now you've learned about what ingredients need to be present in a successful relationship if it is going to work long term. So write all of those things down. And then question number two. Again, you have to be really, really honest with yourself. What is it that I don't want and need in this relationship? You may not really want the exes. You may not really want the kids. You may not really want the financial situation that you have found yourself in with this person. But you have to, again, know yourself and know what you want and what you don't want. And number three, the third thing that you have to ask yourself is, now describe my relationship. So it's what I want, what I don't want, and what is the reality of my situation. And you don't have to write a book, but you do have to write, you know, something that really describes the reality of your relationship, looking at the ingredients, the communication, the problem solving, the sexual chemistry, the emotional intimacy, skeletons in the closet. Have they been acknowledged and addressed and resolved as best as they possibly can? And then it's time to ask yourself, this is also a really tough question, what is compromisable and what is not? Okay, can you compromise not going to fancy restaurants every week? Can you compromise, and this is something that I deal with in my practice a lot, can you compromise not living in $1 million house? Can you compromise not having a house in the Hamptons? What can you and what can you not compromise on? And again, each of us, we're all different. I have a patient right now who cannot compromise on the fact that her fiance is not going to be able to make $1 million. So we've talked about that a lot. And if that's not something that she is willing to take a look at and look at some of the other wonderful attributes that this person is bringing into her life, then she needs to break off the relationship. And I suspect that that's probably going to happen. And then the things that absolutely should never be compromised on, and these things are skeletons in the closet, like untreated psychiatric problems where the person is unwilling, absolutely unwilling to deal with the excessive depression and anxiety and substance abuse, and they are blowing you off and saying it's all in your mind, and they are gaslighting you, and this is who I am. And if you can't handle the fact that I'm going to get drunk every week, and on occasion I'm going to be verbally abusive and may hit you or may hit the dog or may hit the wall, then so be it. These are things that you must never, never, never compromise on. In fact, I had Denise Brown, you know, Nicole Brown Simpson's sister, who was murdered by O.J. Simpson. And, you know, Denise has said publicly that had her sister read my book, had she taken the book seriously, she would probably be alive today, because there are always clues, there are always red flags that we frequently choose to ignore. And what I am hoping is that you're not going to ignore things that can really harm you emotionally, physically, sexually, psychiatrically, and psychologically. This is the time, this is the truth serum really for all of us. So things like poor communication, things like poor problem solving, substance abuse of various different kinds, verbal abuse, physical abuse, sexual abuse. These are things that you must never, ever, ever compromise under any circumstances at all. And it's not about running away from problems. This is not what I'm saying, because what I am saying is that we all have issues, and there are always going to be issues in our relationships. But it is looking at the reality of our situation, and then with our partner. And this is why it is so important that we find partners who we can deal with, who we can problem solve with, who we can communicate with, who are open and willing and able to acknowledge and address and resolve whatever issues come up as best as we possibly can. So in a nutshell, my friends, this is how we can empower ourselves and educate ourselves and really keep ourselves safe. Because if we don't go through this process, we're putting ourselves at risk. So again, to really sum up, as I began in the beginning of the presentation, I was talking about, again, the three things. And when people hear three things, they think, oh, well, three things, that's not a big deal. We can do it quickly. And I'm hoping that I've convinced you that this is not something that can be done overnight. So first of all, if you are struggling yourself with issues from your family of origin, with depression, with anxiety, with untreated bipolar disorder, with any other psychiatric issues, the addictions, sexual abuse, sexual assault, problems stemming from your family of origin, it's not that you're going to forget, and it is also not something that you need to forgive. A lot of people feel that forgiveness is necessary in order to move on. What I have found is that if people choose to forgive, then they choose to forgive. If they choose not to forgive, and that's going to help them to move on, then that is exactly what they are going to do. So we need to be okay. And therapy does not mean that you are going to have to deal with these issues for 1,000 years. If you find yourself a really, really good therapist, and if you're serious and committed to dealing with problems past and present, you would be surprised how the process works, and you would be surprised how it can really change your life and your relationships forever. So again, we need to be okay. Number two, don't want to sound like a broken record, but we do need to be aware and educate ourselves about the ingredients that really do go into a healthy long-term relationships. And number three, and believe me, it's not about selling books. Please, please use my assessment formula. The book, For Better, For Worse, Forever, Discover the Path to Lasting Love. This will help you navigate the relationship. It will help you look at all the things that we all need to look at in order to assess who our partner is, who our partner is not, and whether or not this person is good for us or is somebody that we need to say goodbye to and to extricate the relationship as soon as possible. So again, I want to thank you all so much for Zooming, for tuning in. There are a number of questions here that I'm going to try and deal with right now. And Stevens, Spataro, I want to thank you so much for helping me navigate my first ever presentation on Zoom. I think we did okay. So I'm going to go to the chat room and take a look at some of the comments.
Anyone have any questions or
Yes.
other comments? I could unmute if you want to ask a question, or we have a comment from Joyce who comments, your heart-to-heart delivery is so valuable for our family to hear. You're sincere and honest.
Thank you, Joyce. Thank you. This is really so important for me. You know, of all the things that I have been doing over the past 35 years, and I see people with every conceivable kind of problem, what has disturbed me so much is that with all the books and the talks and the podcasts and the experts, how badly we are doing in our relationships. And I look at the domestic violence statistics and they freak me out. And I look at the fact that the teenage dating abuse, I mean, when I was growing up in Canada, who knew about teenage dating abuse? And I see what's going on the college campuses. And for me, it's about sharing good news. I have learned a lot in my life. I have made my own mistakes. And, you know, in treating thousands of people over the years, I have learned what works. And for people who know me, I'm a very bottom line person. If it doesn't work, that's just toss it out. But this is something that I promise you will keep you safe if you are involved and engaged in trying to find out who your partner is so that you can have a successful relationship. Are there any other comments, Stephen?
We have a question. Someone's asking if you have any other speaking engagements coming up.
Well, I'm going to let you know again, things are so changed with Zoom. I mean, I speak around the country, but now I'm not going to be speaking around the country other than on Zoom. But I will, you know, what I'll be able to do is keep you posted, everyone, through Stephen at the East Hampton Library. And by the way, you can listen to me every Monday afternoon live. My show is the Ask Beatty Show on the Progressive Radio Network, where I tackle all of these issues and I do psychological commentary and analysis about hard news. I have amazing guests who I've learned so much from and who've educated my audience. So again, it's every Monday afternoon from 3 to 4, live on the Progressive Radio Network. You can actually call me. It's a call-in show, and we can talk about anything. And of course, you can go to my beattycohan.com website with contact information, the email, the telephone numbers, and
I'll put the link in here to the podcasts, because they have the previous shows indexed on the podcast. So
that'd be great.
that link is in there. And
yeah, people can listen to my 304 Ask Beatty shows, and I'm just sort of kidding, but this Monday is going to be the 305th show on this particular network.
And what I'll do is I'll put the link to the station in here.
Oh, great.
Which has, there's also indexes of previous shows in here. If anybody wants to hear the previous shows, if they click that link, they'll get the previous shows.
That would be great. And, you know, as I mentioned at the beginning, I have a private practice in East Hampton, and I also have a private practice here in New York. If anybody is interested in a consultation, I'm always happy, you know, to chat on the phone and see whether or not there would be a possibility of our working together. Any other comments, questions?
Do we have any other questions? If you'd like, if you want to use the raise hand or type it in the chat, or if anybody, I have everyone is unmuted. So if anyone has a question they want to ask, you know, feel free to do so.
Well, I hope this has been helpful, because that's why I love to do this every year at the East Hampton Library. Because I always hope, you know, and I say this on my show, that there's some little thing, something that you may say, aha, this is something that is going to make a difference in my life and in my relationships, and that is going to motivate me to take care of some business, unfinished business that I may have yet to have taken care of. And that's why I love to do this, to empower you and to help you and to keep you safe.
Well, I thank you, Beatty, for your time and this superb presentation. A lot of points were brought up that are like spot on. I mean, I could relate to some of the points brought up, and it's very helpful to apply to our relationships with spouses, with dating partners, and just in general in everyday life. And you know, the statistics are, you know, it's kind of sad with the divorce statistics, but you know, everybody just has to, I think the thing that sums it up the best for me is the compromise. The compromise, and there's another term, like, you know, you can delay gratification. Like, if one person wants the mansion, but you kind of don't think you could get the mansion just yet, you can always delay gratification until that time comes. Setting goals, looking forward to something, those are all good things to keep people going, you know, in their relationships. So great stuff.
Thank you. Thank you, everybody, for taking the time on this beautiful Saturday afternoon. Thank you again so much, Stephen. And to be continued.
Okay.
Okay. Bye, everybody.